Hello everyone, myself Dr. Savita Jarad. We are here seeing about the continuation of the introduction of obstetrics. In previous lecture, what we have seen about the pueperium part, that is the time after the delivery, and what we have seen the normal part of it. So just this is the revision part of it. We have seen that is in ops part of it. We have divided into three parts. That is antenatal, intranatal, and postnatal. In that postnatal, what we have seen previous lecture, mother normal part. Now today we are going to see about the mother abnormal part. In postnatal, it consists of two parts related with two parts, that is mother and the neonate. Up to the after the delivery, the product whatever the newborn is called as neonate up to 28 days. So now we are going to see today that is the postnatal part, OBS, postnatal part, mother abnormal part. What are the problems that mother gets suffered after the delivery that we are going to see it. So first of all, what we have to see about the abnormally, just revision of what is normal pueperium. Then and then only we are able to understand what is abnormal pueperium. So what is pueperium? Is the period following the delivery or following the childbirth, which the body tissues, especially the pelvis organs, revert back approximately to that of the non-pregnant state or the pre-pregnant state, both anatomically and physiologically. And how much duration? That is, it is about 6 weeks. And again, it is further divided into three parts, that is immediate, early, and the remote or the late. How much time duration wise? It is about the immediate within 24 hours, then in early, that is in days, that is up to the 7 days, while remote or late puerperium, that is up to the 6 weeks. So now any changes, any problems other than this? So there may be problem with that of sometimes there may be appearance of fever after the delivery, or sometimes there may be presence of the septic condition, or sometimes we may go in the psychological problem. So there are different conditions, or whatever what we have seen that the uterus, it gets reverts back to its normal non-state. If it is not able to do it at the specific time, then there are also problems after the delivery, or sometimes there may be some problems in the veins or some problems in the breast also. So that what we are going to see in this. So abnormalities of the puerperium, that what we are saying in this lecture. So what are the problems that can take place after the delivery, that is during the puerperium time? So it is, there may be some appearance of fever, that what I already said you. Then if there is the presence of some septic condition, and sometimes the whatever the involution, that is what is meaning the uterus, it is coming to its normal pre-pregnant state, that is called as the involution. But if it does not take place normally, then it is called as subinvolution. Or sometimes, and as this, there is appearance of fever, or there is a septic condition, then or there may be some psychological problems. So as this occurs during after the delivery, that is during the puerperium period, so that is called as it is a puerperial pyrexia, or puerperial sepsis, or puerperial psychosis. Then sometimes there may be some urinary complications like UTI, or urinary retention may be there, or sometimes there is a urinary incontinence. Incontinence, that is the control of the urine is not taking place properly. Then there may be stress, urge, different types of incontinence, or sometimes there is a urinary suppression. Then if you see the breast point of view, there are breast complications like. So what are the complications can take place? So sometimes there is a breast engorgement can be takes place, or the whatever the nipples, they becomes the tract or retracted. That may be the problems, or sometimes there is an inflammation of the breast, that and it is remain for the short duration. So that is called as a acute mastitis. Or sometimes there is a abscess formation is also there. So that is called as a breast abscess. That is the problem. Then there may be problem to the veins because there is a blockage into the upper side, so it can due to the thrombosis, and it is the puerperal, and as it is taking place after the delivery, that is called as a puerperal venous thrombosis. And if that it gets ultimately further pathology can lead to that of the pulmonary embolism. And sometimes there are some situations where there is a puerperal emergencies also, or obstetric pulses also there, or something psychotic disorders during the puerperium. That is what I have already told. That is called as a puerperial psychosis. So these are the some problems which occurs after the delivery. Now one by one, what we are going to see, what is the meaning of it. So first, that is what we are seeing in this. It is the puerperal pyrexia or that is fever. That is what you see in this. The fever, it is increasing after the delivery. That is called as a puerperal pyrexia. So what is the definition? So definition point of view, it is a rise of temperature. How much? Up to 100 degree Fahrenheit or 30 degrees Celsius or more, measured orally on two separate occasions, that is at 24 hours apart, excluding first 24 hours. That is, we are not going to include the first 24 hours. Within, and how much time? Within first 10 days. If it is the fever is present after the delivery, then it is called as a puerperal pyrexia. And sometimes that is what we see in this. And in sometimes it may be in some countries, that is if fever is also present after the delivery, that is it is post-abortal fever is also included in the puerperal pyrexia. Then what I have already told, that is sometimes there is a puerperal sepsis also. So this puerperal sepsis, what we see in this diagram, it is an infection of the genital tract which occurs as a complication of delivery, is called as a puerperal sepsis. See, this is a septic condition which has taken place to the uterus. So that is called as a puerperal sepsis. And if you see, there is an endometritis and inflammation and infection of the endometrium, that is the lining of the uterus. And if you see, that is the commonest, it is the commonest cause. If you see in the sepsis, that is, it is endometritis and the endomyometritis. What is an endoparametritis? Meaning of it, all the layers, that is inner, middle, and outer. Endometrium, myometrium, and perimetrium. If inflammation has taken place, that is the cause for the septic condition. That is endometritis here, then here it is endometritis. In between it is the endomyometritis, and last outside it is the endoparametritis. Here. And what I have already explained, that is sometimes it also leads to the problem, that is thrombophlebitis. Phlebitis, that is related with the pathology with the veins, and thrombus has taken place. So it is thrombophlebitis. So ovarian vein of one side is usually involved, and uterine vein may also involve, and it leads to suppuration, embolism to other organs if it leads to. And septicemia and the pioneer. This may lead to the, if the septicemia has taken place and the pioneer has taken place, so ultimately it leads to the other problems like that of endocarditis or pericarditis, or if it affected the lung, renal part, so it can lead to the pathology over there. There is a collection of pus, that is called as the abscess, and if it is takes place to the renal, then it is called as a renal abscess. Or if cell pathology has taken place to the lung, can lead to the lung abscess, and if it goes into the brain, then it leads to the meningitis, or sometimes it is arthritis also. So these are the whatever rare these days with the advent of potent antibiotics, because nowadays there is a very good availability of the antibiotics. So these are the rare chances, but still what we have to think about, that is there may be chances of thrombophlebitis. So what we see is this pulmonary venous thrombus which has taken place over here, that is the blood clot, how the pathology takes place over in the pulmonary venous the thrombosis. And the thrombosis of leg vein and pelvic vein is most common. However, the prevalence is less. So what we see that the swelling and inflammation below the blockage. Here the blockage has taken place. And how it is the looks like this is a normal leg, what we say that. And this is the normal blood flow which takes place to the upside. But when the thrombus has taken place over here because of the blockage or something, so here it is the venous clot which is present. So, but obviously the vein blood supply remains going to the backside over here, and the part becomes the swollen. So this parts become the swollen, and whatever the color of the skin, here the color of the skin it is something pinkish or normal skin color. But here there is a no blood supply proper. The venous drainage is not taking place properly. So definitely the whatever the fresh blood, oxidated blood does not reach in that much good quantity as normal. So what if the skin looks over here whitish is looking. So what is it? And it looks swollen. So for swollen, what we use was this dolan. Dolan means something swelling. Magnesia that is related pathology to that of the veins. And the alba. Alba means white. So this is also called as a white leg. And in other language it is called as a magnesia alba dolens. Can also lead to after the delivery. So that may be the problem. So it is the pelvic thrombophlebitis, which originate in the thrombus vein and the placental side by organisms such as an anaerobic streptococci or bacteriocytes. And when localized in the pelvis called as a pelvic thrombophlebitis. When there is a specific features, but it is suspected when there is a constant fever instead of antibiotics and administration. Antibiotics administration. So how can you clinically see that after delivery, if the complaint starts with that of the swelling of the legs of one leg with that whitish in color, and even there is a presence of but of this infection, if there is no fever is there, you give the antibiotics and still the fever is not subsides, then you can think about that may be related with that pelvic thrombophlebitis that you have to think in mind. And what I have already explained that during the normal pueperium, whatever the changes which takes place in the uterus during the pregnancy, it reverts back to its normal stage. That is what we have seen in the normal pueperium. That is after one day where it is reaches up to umbilical, then after 2 days where it is reaches to slowly, it comes to its normal position. That is called as a involution. But what happens? Sometimes this uterus does not come back to its normal size. That is called as a sub-involution. So definition point of view, when the involution is impaired or retarded, it is called as a sub-involution. That is not taking up to the standard, up normal. It is below that. It is called as a sub-involution. So sub-involution that is not taking the involution of the uterus normally. That is sub-involution. That is impaired or retarded. Then what is the other problems which can take place during the puerperium? So sometimes, as what I already, there may be some urinary problems. So it may be urinary tract infection or the incontinence, urinary incontinence, other problems are there. And what is it? It is an infection of the urinary organs. So such as kidney may be there, it may be problem to the ureter, it may be problem to the bladder, anywhere. So from kidney, then ureter, then bladder, urethra, everywhere. So whatever there may be, sometimes it is a swollen, infected kidney may be there. That may be pyelonephritis is there, or if bacteria enter in the bloodstream, then it may be sometimes there is an infection of the bladder. So all this can lead to the symptoms of related with the urinary tract infection. Then sometimes some females may present with that of breast problems. So it may be related with that of engorgement, or sometimes maybe there is a cracked or retracted nipple, or sometimes there may be some collection of pus in the breast, or there may be some collection of pus is called as a abscess, and where it takes place in the breast, so it is called as a breast abscess. And sometimes there may be problems in the breast, that is there is an inflammation, and inflammation of breast it is called as a mastitis. And as it is required a text space for the shorter duration, then it is called as a acute uh, mastitis. So breast engorgement is there. So see, this is what is happening. This is the non-lactating breast, which is how the milk glands looks like, and this is the engorged. See the size of this. This one is normal. So it is engorged. That is what we are seeing it. That may be the problem after the delivery. Then sometimes the nipples are get problematic. That is, they get cracked or retracted. That is the scenario. So it occurs. Why this is happening? So it occurs due to the loss of surface epithelium or due to a fissure that is situated at the tip or base of the nipple. That may be the scenario that can lead to this cracked nipple. So see in this diagram. This is how it looks like. This is a crack nipples that we are seeing. This. Normally, this is not this. Or a retracting. Yes. Now, there are many acute complications also. So, what are the acute complications? That majority of them are alarming complications. That is, which arises immediately after the labor or after the delivery, and in that, except that of pulmonary embolism. So what are the common complications we can think about immediately that we have to give the importance? So there may be hemorrhage, if it is, that is called as a postpartum hemorrhage, or if hemorrhage is of too much severe, so it can be patient may go into the shock condition. So shock may be there, or sometimes there is a convulsions which occurs after delivery, that is postpartum eclampsia, and pulmonary embolism or inversion. So these are the some problems, that is uterus is turning inside of it. So that may be the problem immediately after the delivery. Then early problems. That is what is meaning of early. That is the problems which takes place within the week in mid-career, then it is comes under the early one. So what can be? It can be related with that of urinary problems or septic condition, or it may be related with the breast, it may be related with the pulmonary. So what are the problems? We can see that it may be acute retention of urine, that is that may be the situation, or sometimes there is an infection of the urinary tract, or sometimes there is a septic condition. And as this is the septic condition, which takes place after the delivery, that is within specific time. So that is called as a pueperian time. So pueperian sepsis is, then breast engorgement is there, then mastitis and the breast abscess is there, and sometimes there is a pulmonary infection can be, it takes place within a week, and anuria following the abruptio placenta or mismatched blood transfusion or eclampsia. If there is an eclampsia has taken, or if you have PPS or something situation, you have blood transfusion has given. So that, or if there is a abruptio placenta, that is the placenta is dislodged before the delivery of the baby from its normal site, then it is the anuria, normal dislodgement of the placenta. So that may lead to the anemia. And delayed, that is what are the problems what we can think about, that is the secondary postpartum hemorrhage and the thromboembolic manifestation, that embolism can be expressed, or sometimes females may go into the psychological problems, that is psychosis, and the postpartum cardiopathy may be there sometimes, or postpartum hemolytic uremic syndrome is there. So these are the some problems which can take place after that is called as a delayed problems of puberty. And what I already explained, that is some psychological problems, that is psychiatric disorders which can take place during the puberty. So see, that is see here. So what are the psychological problems which can take place? So in the first 3 months after the delivery, the incidence of mental illness is high. That is within 3 months. So it is overall incidence is about 15 to 20%. And what are the symptoms? So that maybe sleep deprivation is there, or sometimes there is a hormonal elevation near the end of the gestation, and the massive postpartum withdrawal contribute to that of the high risk. That may be the scenario. Then What are the manifestations? How can we see? This female may it is in the depression condition, or the anxiety may be there, or tearfulness, so that is want to tear the things. Then insomnia is there, not getting to sleep properly, helplessness, and the negative feelings towards the infant. She does not feel that is caring towards the what normal mother feels to his infant. And sometimes no specific metabolic or endocrine abnormalities, means no specific, we can't see that metabolic or endocrine abnormalities, but these symptoms are present. And lower tryptophan, that is neurotransmitter serotonin level, which is commonly observed in this situation. And that all these things that indicates that something, there is an alteration in the neurotransmitter function, which can lead to above symptoms, that is depression, anxiety, fearfulness, insomnia, helplessness, and the negative feeling towards the infant. Then sometimes there is a postpartum depression is there, that is observed in 10 to 20% of the mothers, and more gradually in onset over the first 4 to 6 months following the delivery of abortion also. It is not that after delivery, after abortion also there is. And it is, how is the, it is the gradual onset. It is not suddenly, it is one day prior. The patient is very nice, and second the patient feels the depression. So whatever these symptoms, it starts gradually, and incidence it is about 10 to 20%. And this changes in the hypothalamo-pituitary adrenal axis, which is the responsible for this postpartum depression. So it is observed in 0.12 to 0.26 of mothers postpartum psychosis, which is observed in 0.14 to 0.26% of mothers, which commonly seen in women with past history, and if there is a family history of psychosis, that is a mother or aunt is having some similar complaints, can lead to this. And then onset, how we see that it is sudden. So that is the difference, that what we see that in postpartum depression, the onset it is gradually, while in postpartum psychosis, the onset it is sudden. Then uh, postpartum depression, if you see the percentage wise, it is about more as compared to postpartum psychosis. Here it is about 20% female. It is 20% while in postpartum psychosis, it is 0.14 to 0.26%. And last, how is last for whatever the psychosis period, it lasts for 4 days. That is what we see. So that is, in short, the concept of whatever the problems which can take place to the mother, that is comes under the abnormal pueperium. So that is it. Now, again, we are going to continue about the, that is introduction of obstetrics. That is what we are going to see this part. Postnatal. Now we are going to start about the neonate normal part. So neonate normal part. What are the characteristics which are present? See here, postnatal. We are seeing mother normal, abnormal, normal, abnormal. We have finished. Now we are going to see about neonate normal part. What are they? What is normal in a body? What is meaning? What are the criteria which are present over here? So that what we are going to say. So what is the definition point of view? What is it? A healthy infant which is born at term, that is between 38 to 42 weeks. Again, which is having, should have an average birth weight for the country, that is usually exceed 2,500 grams, that is 2.5 kg, and cries immediately following the birth and establishes independent rhythmic respiration and quickly adapts to change environment is called as a newborn. What are the criteria? First, it should be full term. Second criteria, full term, what is meaning it? That is from 38 to 40 weeks. Second one, how much weight? It is about more than 2,500 gram or 2,005 kg. Next one is it has the baby should be cries immediately following the birth. And second, not only cries but having should establish the independent rhythmic respiration and also adapts to the immediately, that is quickly adapts to the change environment. If this criteria it is followed, then it is called as a newborn baby. That is definition of it. See, this is the how it looks like. It is umbilical cord cut over here. The skin, how much length, how much weight, how much is the hair pattern. That's what you have to observe it. So, what is the physiology and characteristics of this newborn? So what are the vital signs? So temperature, if you see that it has to be 97.7 degrees Celsius, that is 100 degree Fahrenheit. Then what is pulse? That is normal newborn pulse is 120 to 160 beats per minute. How much respiration? It is about for normal it is 40 to 60 breaths per minute. Then how much is the blood pressure? That is blood pressure should be range from 60 to 70 or 31 to 45 mm of Hg. BP is directly related to gestational age and birth weight of the infant. That is the proper relation between BP and the gestational age of the newborn. That is the criteria. That is how what is the pulse, what is the respiration, how much, what is the blood pressure. Then it is with the anthropometric measurement. That is what is meaning of anthropometric. That is height, weight, head circumference, chest circumference is called as anthropometric. So how much height? It has to be 45 to 55 centimeter. How much weight? It is more 2.7 to 3.1 kg. Then that is the length, height wise, weight wise. Then head circumference, it is up to 33 to 35 centimeter, and chest circumference it is up to 31 to 33 centimeter. Then if you see the posture, how is the posture of should be of normal newborn? The newborn assumes the attitude of its intrauterine life. So position, that is what is present, it is contracted, what we know that intrauterine life. That is extremities are flexed and the fists are clenched. That is what we see in this. See, this is the how hand it is clenched. Whatever these hands are flexed and this is clenched. That is position should be there. That is the posture. That is extremities are flexed and fists are clenched. Then general examination, if we see that the overall appearance of newborn, it must be noted that how it looks like. So it should be the whatever the symmetry, it should body shape. If we see it, so it should be symmetrical and cylindrical counter. And head is large in proportion to that of the body, narrow chest and protruding abdomen. See here. Here what we see that there is a symmetry. Second, what we see that head it is large, chest it is narrow as compared to head, and abdomen it is also protruding. That is the characteristics. So protruding abdomen, head is large as compared to the body, and narrow chest. That is what here. And skin color, the normal skin of the color it should be pink and covers the vernix caseosa. The skin is velvet, soft and elastic texture because of subcutaneous fat. And if premature baby skin is thin, red, shiny and cover the laniago. So in that, in above diagram, what we see that it is not red, it is pinkish color. So this is not the red color. And it is not that thin. If you see in the premature, the skin is thin, while in normal neonate, the skin is normal. And this is pinkish color. If it is preterm, so it is having some reddish color. So premature baby is having skin is thin, red, shiny, and cover laniago. And postterm baby will have less vernix caseosa and skin is wrinkled and peeling. It's the single most important parameter of cardiorespiratory function. Then after this one, that is physiology of lactation, what we have seen in the previous lecture. Now after 6 months, then when you stop the breastfeeding or you minimize and you start the outside food, that is called as a weaning. So what is weaning? Weaning means to free from the habit, process of gradual and progressive transfer of the baby from the breastfeeding to the usual family diet. That what we are saying here, we are starting some food which is not other than the breastfeeding. So what is it? So how much time it is when we have to start it? So it is the addition of supplementary feed to the primary feed. That is additionally what we are giving. Then what is the weaning age? It is about from 4 to 6 months. Weaning, the typical order of introduction begins with cereal. So what we can give the food that is in the form of cereal, uh, or iron fortified rice, what we can give it, or sometimes oat or wheat and mixed cereals we can give it, or sometimes whatever the fruits which are properly ripe we can give it. So cooked and pureed vegetables follow, then cooked and pureed fruits or egg yolk, and finally we can think about the ground meats. We can whatever the properly ripe foods we can give to the newborn after 4 to 6 months is called as a weaning. So what is the how is the preparation for the weaning food? That you should properly wash your hand. So keep food in the proper clean utensils. You have to use it. Then the separate raw and cooked food, that what we have to use it. Cook food, proper thorough cooking of the food should be takes place. And whatever this food, we have to keep it in the safe temperature, safe utensils, clean utensils, use safe water and raw material, and give freshly prepared food. Not that you have to already prepare the food and keep it for 2 to 3 hours and then afterwards you give it. So it's not like that. You have to freshly prepare the food and they keep the cooked food covered. That is proper covering should be there. So that is the meaning of the weaning to the newborn, not after newborn, it is a baby that what we have to give it. So that is the concept of weaning. So that is what we have seen about normal, abnormal, normal, abnormal of the mother, and the normal things which are followed to the newborn. That is not what are the characteristic features of the newborn and what is the meaning of weaning. So that is in short concept of it. Thank you very much.